Side effects for the surgeries: if it's a very early disease and we can just do a simple hysterectomy, it's just the same surgical options that a lot of women who have hysterectomies for benign things like fibroids or endometriosis would experience. The radical hysterectomy has more side effects, obviously. Some of the long-term ones can be changes in urinary function. Also, there can be what's called sexual dysfunction as well. The vagina can sometimes be shortened. Those are things that people tend to experience frequently. In terms of the radiation and the chemotherapy's effects for the most part can be short-term, in the sense that people experience them while they're going through chemotherapy, but they recover. Depending on the type of chemotherapy, this can be as small as just being anemic, requiring sometimes blood transfusions, or being at an increased risk for infection. If we're using multiple drugs, sometimes people will lose their hair and often have problems with nausea, vomiting, and increased risk for infection too. Radiation, particularly if it's delivered to the pelvis, has short-term effects, sometimes just irritation to the skin. Sometimes people will find that they have more diarrhea or urinary issues, but radiation also can have long-term effects. The most severe sometimes being something like a fistula, where people have connections between organs that they should not have, such as the bowel fistulizing to the vagina. People can also end up having areas that are increased risk for infection, or lymph swelling, which is called lymphedema. And they can also have changes in their urinary function and their bowel function, and then also what's called stenosis of the vagina sometimes, where it becomes a very sort of fibrotic, narrow tube that can cause discomfort as well.